Well, thank you for having me. I'm Madhura Tamhankar. I'm a professor of ophthalmology and neurology. I work at the Shea Eye Institute, University of Pennsylvania, where I run the neuro-ophthalmology service. I do adult strabismus surgery, and I'm a co-director of the thyroid eye disease clinic that we've had since 2018. I am very excited to be in Denver, actually, because we have a poster that talks about, for the very first time, the natural history of thyroid eye disease. So for many years, it was believed that the natural course of thyroid eye disease followed an active phase that lasted about 18 months to 2 years following the diagnosis of Graves' disease, which was then led to a chronic or more of a cicatricial stage where either patients got better or they got worse and needed surgeries for the proptosis or double vision and to decrease the inflammation in the eye. And this is called the Rundle's curve, which strangely enough was based upon an N of 2, which was really small, as you can imagine. So fast forward in 2026, we looked at over 30,000 patients in the IRIS registry, which is the registry that is owned by the American Academy of Ophthalmology and has data that is very ophthalmology specific. So when you looked at over 30,000 patients with thyroid eye disease and followed them over 1 year, we had some astounding results. Very interesting data because this was natural history. So how did we track these patients? So patients were followed for over 1 year based upon the data that was gathered from the IRIS registry and the Komodo health claims. And if they had any treatment change or if they had any change in their clinical characteristics such as proptosis or clinical activity score or double vision, then it was they were denoted to have a progression of the disease. So overall, amongst 30,000 patients, what we found, and this is humbling, that a third of patients actually had worsening of the Graves' ophthalmopathy over the course of the follow-up period. And this data is first of its kind that has emerged that speaks of how this disease can actually progress and that there may not be, the Rundle's curve may not be true because many of these patients can progress over their lifetime, and that may require frequent monitoring. Early detection of the disease may be very, very useful. So the take home here is that the Rundle's curve, which used to be the dogma back in the day, is no longer true, and that we have a large cohort retrospective data, thousands and thousands of patients followed over years that have shown that there can be a progression in a third of these patients. So it's really important for ophthalmologists to know that it is critical that they have a high clinical index of suspicion when they see a patient come in that has frequent tearing, frequent redness, maybe a little bit more prominence of their eyes, to look for that eyelid retraction and to think about thyroid eye disease as the presentation of their underlying hyperthyroidism. And in such cases, ophthalmologists should be able to order thyroid function tests for that early detection, because that early detection may be the key to stop progression, to restore euthyroidism, and decrease the chances of the Graves' disease of the eyes getting worse. Mild thyroid eye disease can be treated by conservative measures. So smoking cessation, lifestyle modification, establishing euthyroidism, maybe putting them on certain vitamins such as selenium, and counseling them about importance of maintaining their thyroid status is very critical, because all of those things will have a tremendous impact on whether the disease will progress or whether it can be halted in its course. Because the study showed that over 92% of patients were initially detected with mild thyroid eye disease, of which a very small subset, about little over 5%, went on to develop the moderate to severe. And moderate to severe thyroid eye disease is the one that is the most disabling because it's characterized by proptosis, double vision, which can have tremendously debilitating impacts on their quality of life. So what we want to do is early detection. What we want to achieve is prevention. However, if there are a subset of patients that do progress, then such patients obviously can now avail of disease-modifying therapies like teprotumumab, and a smaller percentage who may go on to develop the cicatricial sequelae may need surgery. But I think the take home here is early detection and prevention of progression is very important in this condition.